Hello, I'm Molly, and this is Care Experts, brought to you by CareCredit and Pets Best. Together, the CareCredit credit card and Pets Best pet health insurance provide all the financial tools that can help you be the best pet parent you can be. Today, we are here in Oakland, California with Dr. Ayele Okine. Dr. Okine is a board-certified veterinary internist and is the founder of a mobile veterinary practice that provides ultrasound services for animal hospitals in the Bay Area. Today we are talking about the unfortunately pretty common kennel cough. So Dr. Okine, can you start by just telling us what is kennel cough?
So kennel cough, we tend to associate more with Bordetella, but it's actually a collection of diseases, upper respiratory diseases that we can see in dogs. So it's not just Bordetella. There's a number of other viruses and bacteria that can make it up, but we traditionally think about it as an infectious upper respiratory condition.
That's very scary sounding. So an upper respiratory condition that includes Bordetella, but could be other diseases as well.
Correct.
How do our dogs get kennel cough?
So they get it from other pets. So we traditionally think about it as being something that they pick up in a kennel, but any boarding facility, they can pick it up from, doggy daycare, they can pick it up from, dogs passing each other on a walk. Any pet that is ill with one of these infectious agents can spread it to other pets quite easily. And we can even transmit it on our clothes. If pets share water bowls, that can transmit it as well. So it really is quite contagious.
Highly contagious and transferable in many different ways. What are the signs of kennel cough? What would my dog start exhibiting if they had kennel cough?
So I think the name says it. So most likely we see a cough. We also can see sneezing. We can see kind of a runny nose or discharge from the eyes. So any of those symptoms can be seen, but the traditional kind of textbook case is a pet that is having this cough, especially if they've been around other dogs.
Okay, great. Not great, but
yeah.
Does kennel cough go away on its own? Does it need to be treated? If we let it sit, will it just go away?
So it can go away on its own. So Bordetella, which again is the more common bacteria that we see contribute to kennel cough, it's usually self-limiting within about 2 weeks. Most of the time, people don't let it get to that point because the coughing is very annoying. It can keep everyone up at night. The pet seems miserable. So in a lot of cases, it is something that the pet is being taken to the vet. And it's not wrong. I'm not saying that's a bad thing to do, because anything we can do to shorten it or to make the pet feel better, have the owner get a good night's sleep, it's definitely worth it.
So kennel cough obviously can be very contagious, and we see different symptoms with it. When should I bring my dog into the vet when I'm concerned about kennel cough?
So if you're concerned at all, go to the vet. I always tell people, I'm concerned if you're concerned. The big things to keep an eye out for are if your pet is bringing up any material when they cough, if they're having labored breathing or seem like they can't catch their breath, if they have a fever. So some people will have thermometers to be able to check either the ones for the ear, you can even check a rectal temperature at home. If they feel hot, sometimes people are good at being able to pick that up. If they're not eating or drinking, if they're having a lot of discharge from their eyes or nose where you're having to wipe it away, every couple of hours, those would be signs that I would say, is this a complicated infection? Do they have pneumonia? Is it something else going on? But bottom line is, if you're concerned, I'm concerned, and go to the vet.
If you're concerned, get them into the vet.
Yes.
I mean, it's the only way to really alleviate your stress, and they'll tell you what's going on.
Correct, and then you don't have to guess about it, then you know.
So when the dog does go to the vet for, what could be kennel cough, if it does turn out that's the diagnosis, how is it treated?
So typically it's more symptomatic. So there is an antibiotic that can be given if we think it's Bordetella. If it's a viral infection, then antibiotics really aren't going to help in that scenario. So it's really giving it time, supportive care. It's really on the fence about whether or not your vet might do a cough suppressant. There's some thought processes that if they are bringing up a little bit of material and you're suppressing that, could it lead to pneumonia? So it really depends on what your vet's most comfortable with. But, treating any cough if they feel comfortable, using medications that can help stimulate appetite if they're not eating great. Those are all things that can be given. And then the antibiotic, if it does end up being the Bordetella, that can be helpful.
We'll be back with more Care Experts after this brief message from CareCredit.
Thanks to CareCredit, I can take care of my best friend.
Thanks to CareCredit, I can smile again.
Thanks to CareCredit, I can be confident.
Thanks to CareCredit, I can prepare for veterinary care.
I can take care of myself again.
I can be myself again.
I can plan for Cooper's care.
I can take care of my pug family.
I can.
I can.
I can.
I can have peace of mind.
Welcome back to Care Experts. Let's continue our discussion with Dr. Okine. So kennel cough, a typical infection of kennel cough, how long would that last?
So usually it's about 2 weeks from kind of beginning to end. In some scenarios, they actually are infectious and have the virus or bacteria before they start to show clinical symptoms. So it could be a little bit longer than that. But usually they have symptoms for about 10 to 14 days or so.
So 10 to 14 days, about 2 weeks. And how serious is kennel cough? When we get a cough and we get our treatment, you don't think of it as being that serious, but with how contagious it is, can it be life-threatening? How serious is it?
So the run-of-the-mill kind of kennel cough, Bordetella, those viruses, usually not. Usually it's kind of like our common cold. It's something that, yes, it's very contagious, but most pets that have a competent immune system will clear it without an issue. The big thing is that once you know that they are coughing and that they're contagious, you want to keep them out of doggy daycare. You don't want to expose them to other pets that may have other conditions that do make it more severe. So if they're immunocompromised or on medications that suppress the immune system, it may allow that infection to go deeper into the lungs and become pneumonia. So those would be situations where it could end up being life-threatening if it does turn into pneumonia, or if it's not truly kennel cough and it's some other infectious agent that can go other places in the body. That's when it would be more serious.
And that's a great point, not to put your dog back in doggy daycare, not to have them around other dogs with how contagious it is.
Correct.
That's very important to think about as well. How long is kennel cough contagious from once the dog has been diagnosed or before?
So usually after they've had symptoms, I usually recommend at least a week to stay away from other dogs, just so we make sure they fully clear it. The good thing is most reputable doggy daycares are going to have them vaccinated. So that's going to be a prerequisite to even board them or have them in doggy daycares, that they get their Bordetella vaccine. So most of the time, those are pets that have a less likely chance of actually picking it up there. But there's always situations. There's always situations where one of those pets might be exposed to another dog that isn't vaccinated, and they still could get it or transmit it even if they're vaccinated. It just decreases the likelihood of them getting it.
So is that the best way to prevent, is to vaccinate for kennel cough, for the flu? Are there any other means of prevention that we can take to keep our dogs from getting kennel cough?
Those would probably be the big ways. And then also minimizing exposure to unvaccinated dogs or dogs where you don't know the vaccination status. So we all love to socialize our dogs, which I think is great, but you also want to be responsible about who you're letting your dog come into contact with. And ideally it'd be people that you trust, pets that you trust, pets that you know, or at least pets that you know are vaccinated to minimize that spread as well.
Okay, great. Well, thank you so much. These are very informative questions. It's always so scary when our dogs develop a cough. So it's really nice to know, take them into the vet and what our possible options are to help our family members out, our little four-legged family members.
Absolutely, our furry family members, exactly.
Thank you so much, Dr. Okine.
Absolutely, my pleasure.
Thanks for watching. All of our featured care experts recommend and accept the CareCredit credit card, which is accepted at hundreds of thousands of provider locations nationwide. And Pets Best offers comprehensive pet insurance plans that can cover up to 90% of your pet's unexpected eligible veterinary expenses. Together, Pets Best and the CareCredit credit card allow you to have a lifetime of care for your four-legged family member. Visit carecredit.com for more information.